Using My Health Record has been a huge time saver. There's a number of practical things we often need to get, such as discharge summaries, pathology results, previous medication histories, previous consult histories. Using My Health Record has allowed myself and our staff to have often immediate access to that and not have to ask people, whether it be staff or patients, to track things down, get copies of various reports. We've got it all there, ready for the consult, ready to go. It's really removed a significant time burden and personnel burden. It allows us to streamline the practice, which is more efficient for us as business owners and clinicians as well. So using My Health Record to be able to view a patient's clinical history has often provided me a much greater understanding of that person. Information that may not have been contained in the referral, or that the patient themselves may not have remembered or been aware of, and often that's had significant clinical implications. I've found access to Medicare PBS history and consult history hugely helpful, probably one of the most helpful aspects for me. Often the patients I see have a long, complex medication history. The nature of their illness often means they may not remember what the doses were, when they were taking it, how long they were taking it, for example, and we've got access to all of that information. So using My Health Record has enabled me to communicate with all of the other health professionals, particularly through the consult history. A lot of patients might have their regular GP, for example, but they've often seen a number of other providers as well. We've got access to who those people are, so that with the patient's consent we can keep everyone informed and keep the communication channels happening. The use of My Health Record has enabled me to offer what I feel is more comprehensive, better care. Primary reasons being that I have access to such a wide, comprehensive range of information that enables me to make the most informed treatment decisions. Through the use of My Health Record, I can be confident that if any of my patients do present in a critical care or acute care centre, that my most up-to-date information is going to be accessible, and that's almost certainly going to assist and inform their care. With regards to how I access My Health Record, my practice management software has only recently integrated it. So I've simply been logging in through Proda at the start of my workday, having the My Health Record there and accessible, and simply logging back in throughout the day if I need to, particularly for any new patients or initial consults. Before I started using My Health Record, I was unsure that it was going to be helpful and had concerns that it was going to create more administrative work, not streamline that process. I would frame it for my colleagues as view it as a trial. You're not committing to using this forever, but you may well be surprised, as I was, at how much information it gives you in a really efficient manner. I think we need to acknowledge there is an initial period of setup required, but after that initial setup period, it runs very smoothly and has formed a crucial part of my everyday practice. Regardless of specialty, much of the information that we need to access and need to synthesise to make clinical decisions is universal. So having access to that all in the one spot in an easy, practical way is almost certainly going to streamline a variety of specialties, practices and decision-making processes.